Hello all, and welcome to Health Professions Week. My name is Kaylan Gaines, and I am joined by my colleague,
I'm Rebecca Greskoviak.
and we are part of the admissions and recruitment team here at Concordia University, Wisconsin School of Pharmacy. Today, we're going to talk with you about what is pharmacy and pathways to become a pharmacist. This is going to be the agenda for today here. So we will touch on these 4 different topic points today. So we'll start with the first one on what is a pharmacist. So when you think of a pharmacist, what immediately pops in your mind? You may think of Walgreens, CVS, or your local community pharmacist in a white coat behind a counter. But do you actually know what a pharmacist does? Pharmacists are doctors who are medication prescription and drug experts. They prepare, dispense prescriptions, and ensure medicines and doses are correct, prevent harmful drug interactions, and counsel patients on the safe and appropriate use of their medications. The knowledge and expertise that pharmacists bring to the team are in high demand, and they bring a lot of expertise to the healthcare team. Lastly, a lot of people don't know this about pharmacists, but they are actually doctors because they graduate pharmacy school with a PharmD or Doctor of Pharmacy degree. So if you were to pursue pharmacy, you will be addressed as a doctor and then fill in your last name. Here are some qualities of a pharmacist that you maybe already have and uphold. So the most important qualities are going to be communication, relationship building, continuous learning, and scientific aptitude. So with communication, you have to be able to communicate on the healthcare team and also with your patients in a clear and articulate way for them to understand what you are asking and needing of them. Also, with relationship building, you have to be able to build a deep relationship with your patients and the healthcare team that you're working on. You have to be a continuous learner with the new medicines and medications that constantly come out. And then also you have to enjoy science or at least be good in science to be successful as a pharmacist. Pharmacy falls typically in these 6 areas: pharmacy practice, pharmaceutical industry, academia, government, technology, and business. Pharmacy is a very broad field, so you can essentially practice in anywhere on the healthcare field with the pharmaceutical component to it. These are some specialty areas that people typically look into when it comes to pharmacy. So as you can see, there's a number of different areas that you can go into. And specifically, there's over 100 pathways that are specialty areas that pharmacists can choose from when it comes to their career. So why should someone consider pursuing pharmacy? The first one is pharmacists get to enhance patient care, promote wellness, and treat patients. You have to want to help people, and you have to want to enhance patient care, and you get the chance to do that as a pharmacist. You also get a chance to interact with your patients. In pharmacy, you get that opportunity to really work one-on-one with them and see those improvements daily. Also, pharmacists have autonomy and can work independent, and they also can work with other healthcare professionals daily. So you can be on that healthcare team, and also you can manage your own pharmacy. Wide variety of career opportunities in pharmacy. So as stated in previous slides, there's over 100 pathways you can go in pharmacy, and there's that variety where you can work in one setting for a couple of years and switch over to another. Other piece is high earning potential. So pharmacists on average come out of pharmacy school making over 6 figures, and the average pharmacist salary is $120,000 to $125,000. So high earning potential. Also accessible and trusted professional. Pharmacists are the most accessible healthcare professional out there. If you were to kind of just look around, there's probably a pharmacy near your hometown or near your house. So they're very accessible. And then lastly, pharmacists help people live healthier and better lives.
All right, so next we're going to look at the pathways to become a pharmacist. There are 3 timelines you can take on your way to pharmacy school, completing your prerequisite courses over 2, 3, or 4 years before beginning the PharmD program. If you do not feel prepared to handle the rigor of pharmacy school after just 2 years in undergrad, you can take an additional year to feel more prepared. The 4+4 option would allow the student to obtain a bachelor's degree before going into a PharmD program. It is not required to be a practicing pharmacist, but it is an accomplishment some students like to achieve. Specific pre-pharmacy courses and overall credit amount changes school to school. You may apply to pharmacy school before completing all these prerequisite courses. However, you must have them completed before starting in the fall if you are admitted. If you have any questions about your pre-pharmacy course requirements or want to know how many credits you have left to complete your prerequisites, we encourage you to communicate with the school you are interested in applying to. So how do you become a practicing pharmacist? The first step is, of course, completing your PharmD program. After the 3 to 4 years in pharmacy school, you will study for and take the NAPLEX, or North American Pharmacist Licensure Examination, which assesses your competency and knowledge so you can be awarded your license to practice. Depending on the state you'll practice in, you'll want to apply for state licensure and may have additional exams to take before becoming a fully licensed pharmacist. Some students do opt into a residency or fellowship after graduation, which are typically 1 to 2 additional years of training. If you are looking to work in a niche area of pharmacy or feel you want additional training or certifications before practicing, a residency may be for you. So what exactly makes someone a competitive applicant for pharmacy school? Well, we base it on a number of different factors. We review each applicant's profile holistically, which means we look more at just your academics or your grades. With our holistic admissions approach, other factors that we review are your references, service activities, motivation to become a pharmacist, and your exposure to pharmacy. So the first 2 areas that we review are your academic performance and your references. We do prioritize applicants who do have higher GPAs and really do look closely at the grades you received in your science courses. If you did have any academic struggles, though, talk about how you overcame them. The next area that we do look at are your references. We do value references that highly recommend the candidate and can speak to your strengths. Prioritize references that know you professionally or academically, and stay away from personal references such as family or friends. In your application, you also want to show your involvement with clubs, student organizations, sports, community organizations, etc. If you're not involved, get involved. The next area that we look at is your motivation in pharmacy and how you become interested in the field. The goal here is just to understand why you chose pharmacy, maybe rather than a different health profession or career pathway. Another area that we look at is your exposure to pharmacy. We recommend applying to become a pharm tech, volunteering at a pharmacy or hospital, or interviewing pharmacists in your community. You can also mention here if you do have any friends or family members that spark your interest in the pharmacy field. And the final portion of your application we consider is your essay. For success with your personal essay, ensure it is engaging, personable, and descriptive to resonate with your reader. Overall, you want your application to fully embody who you are personally, academically, and professionally. We want to see your personality, your strengths and weaknesses, and why you are going to be a great fit at the school that you are applying to. So thank you for joining us today. We do hope that the presentation was informative for you.